Margaret is 71 years old. She lives alone in a small town in Vermont. One morning in January, she opens a letter from her Medicare Advantage plan. The letter says her plan no longer exists. It is gone. Terminated. She has had this plan for 9 years. Her doctors are on this plan, her prescriptions are on this plan, her dental coverage, her vision coverage, all of it, gone. She calls the number on the letter. She waits 45 minutes. When someone finally answers, they tell her she has been moved to something called Original Medicare. But her prescriptions? Not covered unless she signs up for a separate drug plan. Her dentist? Not covered at all, and there is a deadline. If she misses it, she will pay a penalty on her drug coverage every single month for the rest of her life. Margaret is not alone. According to a study published in one of the most respected medical journals in the world, nearly 3 million seniors are in the exact same situation right now, and that is only half the story. I am Faria, and I research the official rules that affect your retirement, your Medicare, your Social Security, and your financial security. I do not repeat rumors. I do not guess. Every single number I share in this video comes directly from Medicare.gov, the Centers for Medicare and Medicaid Services, the Kaiser Family Foundation, or AARP. In the next 10 minutes, I am going to explain exactly what is happening with Medicare Advantage plans in 2026. I am going to tell you about a brand new government program that is using technology companies to review your medical claims before your doctor can even treat you. And I am going to give you 3 steps you can take today to make sure you do not lose a single dollar of the coverage you have earned. But please stay until the end, because there is one mistake. One simple, quiet mistake that 88% of seniors make when their Medicare claim is denied. And that one mistake is costing people thousands of dollars every year. I will show you exactly how to avoid it. Let me tell you about Robert. Robert is 67. He retired 2 years ago from a manufacturing company in rural Ohio. He signed up for a Medicare Advantage PPO plan because it covered his doctor visits, his prescriptions, his hearing aids, and even his gym membership. One premium, one card, simple. Then in October of last year, Robert got a letter. His plan was leaving his county. The insurer decided it was no longer profitable to operate there. Robert read the letter, felt confused, and put it in a drawer. He thought, maybe it will work itself out. Maybe they will send another letter with a new plan. They did not. On January 1st, Robert was automatically moved to Original Medicare, Parts A and B. Hospital and doctor visits were still covered. But his 12 prescription medications, he had no Part D drug plan. For 3 months, Robert paid full price at the pharmacy, over $1,100 out of his own pocket. When he finally called 1-800-MEDICARE in March, they told him something that made his stomach drop. Because he had gone 3 months without creditable drug coverage, he now owed a late enrollment penalty, 1% of the national base premium, $36.78, multiplied by 3 months. That penalty would be added to his Part D premium every single month. Not for a year, not for 5 years, for the rest of his life. But that was not the worst part. In February, Robert's doctor recommended a knee procedure. The insurance company handling his old plan's remaining claims denied the prior authorization. Robert assumed that meant Medicare would not pay for it, so he canceled the surgery. What Robert did not know is that more than 80% of Medicare Advantage denials are overturned on appeal. He had the right to fight that denial. He just did not know it. Robert made 2 mistakes. He ignored a deadline, and he accepted a denial without question. Those 2 mistakes cost him thousands of dollars and months of unnecessary pain. I do not want that to happen to you. Let me walk you through what is actually happening right now. I am going to break this into 3 parts: the plan exits, the new AI program, and the denial problem that almost nobody talks about. Part 1. the largest wave of Medicare Advantage exits in history. A study published in JAMA on February 18th of this year analyzed over 192 million enrollee years of data. Here is what the researchers found. From 2018 through 2024, the average rate of forced disenrollment from Medicare Advantage plans was about 1% per year. In 2025, it jumped to 6.9%, and in 2026, it has reached 10%. That means approximately 2.9 million seniors have been forced off their Medicare Advantage plans this year alone. This is not evenly distributed. In 7 states, more than 40% of Medicare Advantage enrollees lost their plans. In Vermont, 92.2% of MA members lost coverage. Rural seniors are hit hardest. They make up 28% of all disenrolled members, but only 15% of those who can find comparable replacement coverage in their area. Now, here is the critical thing you need to understand. If your plan was terminated, you are not uninsured. CMS, the Centers for Medicare and Medicaid Services, automatically returns you to Original Medicare Parts A and B. That means your hospital visits and doctor visits are still covered. But Original Medicare does not include prescription drug coverage. You must actively enroll in a standalone Part D plan. And if you had dental, vision, hearing, or fitness benefits through your old MA plan, those are gone unless you purchase a separate Medigap supplemental policy. You have a special enrollment period. It runs from December 8th through the last day of February. During that window, you can join a new Medicare Advantage plan, enroll in a Part D drug plan, or stay on Original Medicare and add a Medigap policy. If you are leaving MA for the first time, you also have a guaranteed issue right to buy certain Medigap plans, A, B, C, F, K, or L, with no medical underwriting. But you must act within 63 days of your MA coverage ending. After that window closes, insurers can deny you or charge you more based on your health history. You can compare plans right now at medicare.gov, POC Plan Compare. Write that down. I will put it in the description. Part 2. The new AI Prior Authorization Program. On January 1st of this year, CMS launched something called the WISeR model. That stands for Waste Reduction Through Insights, Solutions, and Evidence Review. This is a 6-year demonstration program that runs through December 31st, 2031. For the first time ever, Original Medicare, not Medicare Advantage, but traditional fee-for-service Medicare, now requires prior authorization for certain procedures. This applies in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. Up to 6.4 million beneficiaries could be affected. Now, before you panic, let me tell you exactly what this program does and does not do. It covers only 13 specific procedure categories. These are procedures that CMS identified as high cost and prone to waste or overuse. They include things like skin and tissue substitutes, electrical nerve stimulator implants, and knee arthroscopy for osteoarthritis. Skin substitutes alone cost Medicare $10.3 billion in 2024, a 2,000% increase from just 5 years earlier. The program does not cover emergency services. It does not cover inpatient hospital stays. It does not change any existing Medicare coverage rules. And it does not apply to Medicare Advantage at all. MA plans already have their own prior authorization systems. Here is the part people are most worried about. Technology companies are involved in processing these prior authorization requests. But CMS's own operational guide, which I have read in full and linked in the description, states clearly that every denied request must be reviewed by a licensed human clinician, not a computer, not an algorithm, a human being with a medical license. Standard decisions must be made within 72 hours. Expedited decisions for cases where your health is at serious risk must come within 48 hours. And if your doctor's request is denied, they can resubmit it with additional documentation as many times as needed. There is no limit on resubmissions. A peer-to-peer clinical review is also available. If your provider skips the prior authorization entirely and just performs the procedure, the claim goes through a prepayment medical review by the Medicare administrative contractor. That process is slower, potentially weeks instead of days, and the claim could be denied, which could temporarily shift costs to you while you appeal. Part 3. The 80% secret. Nobody is talking about. This is the part of the video I need you to pay the closest attention to, because this single fact could save you thousands of dollars. In 2024, Medicare Advantage insurers made approximately 53 million prior authorization decisions. They denied 4.1 million of them. That is a denial rate of 7.7%, up from 6.4% the year before. Now here is the number that should make you sit up straight. Of those 4.1 million denials, only 11.5% were appealed. That means 88.5% of seniors who were told no simply accepted it and moved on. But of the denials that were appealed, 80.7% were partially or fully overturned. Let me say that again. More than 80% of seniors who fought a denial won, but almost 90% never fought at all. Based on those numbers, approximately 3.6 million denials in 2024 went completely unchallenged. If those seniors had filed a simple first-level appeal, an estimated 2.9 million of them would likely have had their denial reversed. The denial rates also vary dramatically by insurer. United Health denied 12.8% of requests, Centene denied 12.3%, Humana denied 5.8%, Elevance denied 4.2%. And under the new CMS rule, CMS 0057F, effective this year, Medicare Advantage plans are now required to issue standard prior authorization decisions within 7 calendar days and urgent decisions within 72 hours. They must provide a written reason for every denial, and they must use standardized electronic processes. You have the right to appeal. You have 5 levels of appeal. The first level is a plan reconsideration. You file it within 65 days. If the plan still says no, the case goes to an independent review entity that has no connection to the insurance company. If you still disagree, you can request a hearing before an administrative law judge, then a Medicare Appeals Council review, and finally, judicial review in federal district court. If your health is at immediate risk, you have the right to a fast appeal. Decisions on fast appeals must come within 72 hours for Medicare Advantage and 48 hours under the WISeR model. You can also appoint someone to handle all of this for you, a family member, a friend, an attorney, using CMS Form 1696. And every state has a free counseling service called SHIP, the State Health Insurance Assistance Program, that will help you understand your rights, compare plans, and file appeals at no cost. Find your local SHIP counselor at shiphelp.org. Here are the 3 things I need you to do this week, not next month, this week. Step 1. Check your Medicare coverage right now. Go to medicare.gov, Doc Plan Compare. Enter your zip code. See what plans are available in your area for 2026. If your plan was terminated, confirm that you have enrolled in a Part D drug plan. If you have not, do it immediately. Every month you wait adds a permanent penalty to your premium. Remember, 1% of $36.78 for every month without creditable drug coverage. That penalty never goes away. If you are moving from Medicare Advantage to Original Medicare for the first time, you have a guaranteed issue right to buy Medigap plans A, B, C, F, K, or L with no medical questions asked, but that right expires 63 days after your MA coverage ends. Mark it on your calendar today. Step 2. Never accept a Medicare denial without filing an appeal. If any procedure, test, prescription, or service is denied, ask your doctor's office for the denial letter. Read the reason. In many cases, it is a paperwork issue, a missing document, or an incorrect code. Your doctor can resubmit. If the denial stands, file a Level 1 appeal within 65 days for Medicare Advantage or 120 days for Original Medicare. Download the official Medicare Appeals booklet. It is free. The link is medicare.gov, publications 195925, medicareappeals.pdf. I will put it in the description. And call your state SHIP office. They will walk you through every step at no charge. That number is 1-800-MEDICARE, 1-800-633-4227. Step 3. If you live in Arizona, New Jersey, Ohio, Oklahoma, Texas, or Washington, talk to your doctor about the WISeR program. Ask them if any of your upcoming procedures fall under the 13 categories that now require prior authorization. Make sure they submit the request through the WISeR portal and not just through the regular Medicare administrative contractor. The portal gives you a 72-hour decision. The regular channel can take weeks. If your request is denied, your doctor can resubmit with additional documentation. There is no limit, and a peer-to-peer review with a licensed clinician is available. Do not let a first-round denial stop you from getting the care you need. I want to be honest with you for a moment. The rules around Medicare, Social Security, pensions, and retirement are changing faster right now than at any point in the last 20 years. 3 million seniors lost their Medicare plans this year. A brand new prior authorization system just launched in 6 states. Denial rates are climbing, and most people do not find out about these changes until it is too late. YouTube notifications are not reliable. The algorithm decides what you see and when you see it. You could miss the one video that saves you thousands of dollars. That is why I created the Global Senior Alerts Official WhatsApp channel. It is free, it is private, and it sends you real-time alerts the moment something changes with Medicare, Social Security, pensions, bank rules, insurance policies, or travel regulations that affect your retirement. When you join, you can also download our free Senior Benefits Protection Guide. It has every deadline, every form number, every phone number, and every website you need, all in one place. The link is in the description right below this video. Click it right now while you are thinking about it. And if you found this video helpful, I need you to do one more thing. Share it. Send it to a friend. Send it to a family member. Send it to anyone you know who is on Medicare. Because the 88% of seniors who never appeal a denial, they are not making a choice. They just do not know they have the right to fight back. Now they do. I am Faria. I will see you in the next one. Stay informed. Stay protected.